Hello and welcome to this live from Renee McDonald. I'm the Director of Australian Online Therapy Training, and I have Rodney here with me from the Help Now group. And I want to introduce Rodney, and he's going to be one of the speakers at the Conference Vision for 2020. So welcome, Rodney, and just if you could tell everyone a little bit about yourself.
Yes, good afternoon. Thanks, Renee, and thanks very much for having me. I'm very, very excited for those out there watching. I'm very excited and honored to be invited to the Vision for 2020 conference. I'm just pumped. I think it's a great way to start the year, bring like-minded professionals together and some off the beaten track professionals to come together and put our heads together to plan to serve the Australian community. A little bit about me. I've run the Help Now group since 2016. I've been a social worker over 15 years in both America and Australia. And I run my own private employee assistance counseling program, as well as just recently appointed president of the Peer Work Association, which is for mental health peer support workers. And a big thing for me is just having that life cycle of mental health service delivery, and each step of the way, not just from I've got some issues to I need a white jacket. I think this group of professionals coming together is going to help people have that stepping, that staged mental health intervention connections, which is really cool, from online counseling to your local GP to psychiatry. I think it's a great opportunity for me and all of us coming out there, and those looking to, humming and hawing if they're going to buy tickets, to come out, and it's going to be very, I like the design of how the conference is set up, and you can see me on both days, on the 20th and 21st of January in the Gasworks.
Yeah. Thanks, Rodney, because you've told everyone what I was going to say. But what I'm finding interesting, and thank you for sharing that so far, is I think you and I have a lot of synergies, probably is the right word, where we're both working in tech and therapy, and both also supporting at each and every stage. So I'm a supervisor, I'm a mentor and coach and therapist and all that kind of stuff. And I know you do very similar things and do EAP. So I see there's a lot of similarities. But what I wanted to talk to you today in particular was, I guess, first and foremost, what are you going to talk about at the conference, and why do you think that everybody should come, I guess, listen to what you have to say?
Yeah, absolutely. I think, look, day one for me is part of my ASW accredited CPD series, which is very much focused on transitioning professionals that don't have a lot of tertiary education and training in technology, and they don't like to fiddle enough with it, like you and I have, to make it work for them and make the mistakes and learn from those mistakes. And my focus really is going to be about just my journey, my lived experience in tumbling through those learning blocks, but also I think a big thing that Help Now Group hangs their lapels on is really being tapped into other industries and knowing that there's so many elements that every single business owner has, HR, payroll, appointments, security, taxes, there's so many, it seems like such a narrow bandwidth for people to go, I need appointment software, I need all these different things. And Help Now Group, a big thing for us is having other people that run technologies within marketing, within business and taxation and all that good stuff that continues to just change at a rapid pace. And for us, with our technology for booking systems and domain management, and I guess a big thing for us is we'll be talking about democratizing that type of thing, because I know professionals, and the ones I've spoken with in our group, the 18 we have nationally, that a big thing for them is having ownership over it, but not getting overwhelmed like maybe you had before, maybe I had before, where I have to know everything about the taxation, the accounting software. I have to know
Yeah.
everything about the
Yeah.
WordPress management. I have to know
Yes.
everything about
Yeah.
the appointment booking system. And it's very easily spirals,
Yeah.
and it doesn't have to.
Yeah.
And that's why, for us, it's and the conversation is going to be, how do you put yourself in and have the right strong relationships where you still have your domain,
Yep.
but you're not burnout on the back of house stuff
Yep.
to serve frontline people, and you
Yep.
can save more cost
Yep.
having a really good relational team that has that other technology expertise, because it's very easy, as you and the viewers out there might have seen previously,
Yeah.
when they tuck into their BAS reporting, or they tuck into
Yeah.
their marketing builder or whatever it is,
Yeah.
they lose hours and hours. And I've seen it. I've done it. I'm guilty, hand on heart.
Yeah.
I've done it.
Yeah. Yeah.
I guess just talking about where those stepping stones are for people,
Yep.
and just transitioning their practice into something where they're really full, because they're still out there wanting to change people's lives, and it's transformational.
Yep.
And they've honed those therapy and theory skills and practice, and they've done that with them.
Yep.
And you just hate that energy sucked away, that as
100%.
it just gets sponged away by that stuff.
Yeah.
Sleepless nights and
Yeah.
and domain management systems.
Yeah.
So,
Yeah.
yeah.
Boring.
Yeah. So that's and look, it'll be good to have. It sounds like a very diverse group that's coming.
Yep.
So look, we don't have all the answers, but I think we've got some pathways for people.
Yeah.
We can talk about, and things that work for me now, so people can avoid those pitfalls that are very, very easily jumped into when they are doing practice, or they've got a hold on it, and then Google changes all their API records and everything. Freak out. Yeah. So just being able to hold on to the wheel, I think, is probably important in 2020.
I 100% agree. And what's interesting, you coming in, you're almost talking similarly yet differently to Yanni Zapanos, who's from Core Plus. So he does the front end stuff and looks after the back end for people. And you're talking about democratizing it. So I think what's brilliant is there will be people be able to see whether you can do it for yourself or whether you want someone else to do it for you. And I talk to both, which is really interesting. So I talk to how could you do that or do the other, and what the upsides and the downsides are. So I think this will be really interesting to have, particularly you, myself, and Yanni there talking to people about how do you get this stuff organized so it actually is a better experience for both you and your clients, so that we're giving better service, but also more at the ready service. And so I'm hearing you. So digital disruptions you'll be talking about. I'm just wondering what the focus will be for your talk.
The big focus for me is how people engage with systems. It doesn't, Yanni's system, our system, Zero system, MYOB. I think it's look, it's almost a self-care kind of conversation on pick the ones that you think you've got a hold on, and how you're calculating your time. I think, I hear, the war stories of people working through NDIS and Medicare paperwork and, DVA and lots, they work through their systems, their information systems. And then they've got to work through their private systems, and they just, I think, look, to carry on, it's making sure they have a good roster of tools, but I think how they're calculating their time a little bit better. And just going, when changes will be introduced, because we've got some international, they work with international servers for big multi-conglomerates about changes to security, and warning me about don't buy Apple and lots of other things. We talk, able to talk with them, get to some industry knowledge, so they're really measuring out their time properly, because I think disruptions will come,
Yeah.
and I think it's just making sure that they're understanding how I mean, a lot of your stuff, and I think the other people chatting is those users engagements and connecting with those individuals.
Yep.
And I think for our session, the contrast will be how we're interacting with that system ourselves.
Yes.
And our time management around that, and making sure that we know when it's blowing out, and
Yep.
we know when to ask for help, and not lose control when we do ask for help, because I think that's a big fear of practitioners going, oh great, I'll have a practice management tool, or I'll have a website managed by someone else, or third party, and pay through the nose or whatever. But I know there's always that thing in the back of the mind going, well, if I do it myself, then I know I have all the control of it, which is not it's not necessary. It can be done, but it takes considerable amount of upskilling and learning to do that. So I guess just talking about bridging that gap and giving themselves time to learn it, because I think anyone that introduces systems and technologies to people, it's, whoever you engage, it's, training them how to tune into the right language of what they're saying to them. And also just making sure that they're building a space that they can grow. They're not growing dependence like we do with clients. I mean, it's very similar. They're giving domain therapy, right? C-panel therapy.
Yes.
And I think, it's very similar. And when I talk to developers, and I talk to bookkeepers, and I talk to marketing guys, and they're using systems, the big message is they want the same thing. They want the same thing, to not create dependence, help people grow when they're ready to grow and they have space. Because if you have too many clients or whatever, you're working a couple of jobs, and you want to manage something yourself, find solutions that give you space and time to learn to use those, and then you can fully take control without losing time and money.
Yes. I think we both have similar aims, definitely, Rodney, in terms of your stuff and my stuff. And mine's more like the front end of how are we actually holding the space for clients in this kind of space too, as well as working with the system. So you've got to have both.
Sure.
So I'm hearing you on many different levels there from what you're saying. So I'm also interested in the mental health advocacy talk that you're also going to be giving on the second day. So there's 2 days of the conference. There's an initial full conference the first day, and then there's it's basically like a big training day on the second day. So going much more immersing into different topics, and yours is, I think you're about 45 minutes on the first day and about 45 minutes on the second day, but then you're going to be part of our panel. So I'm just interested particularly on the mental health advocacy.
Sure. Well, look, day 2 is going to be fantastic, I think, because of that fine tuning and how people are going to branch out and really unpack, either own their space and what they're doing, or learn new things. Look, I think from a social work perspective, what I've seen in the industry, whether it's politics, whether it's association driven, member driven directions with things, I guess it's going to be really unpacking where those barriers are. And I think, maybe I've listened to John Lennon too much, but I think, we can all probably, imagine a world together, living in peace. And I think, as I've unpacked some mental health peer support stuff and a big charge towards that, I think if we're not united in public policy, as a counselor, psychotherapist, Reiki, drumming, whatever those things are that are helping people heal and grow and get vibrations to change their lives. If we're not having shared vision of addressing that life cycle, it'll be unpacking what I talked about previously, which is that customer life cycle, from things are a bit murky, I've been away from work a couple of days, I'm not feeling that well, to diagnosis and prescriptions. Is making sure how we're tuning in and making sure that we've got a team with us. Again, it's that relationships with people, like you and I, collegial relationship, and how we're able to pass people through different systems without losing our territory. Because I think, I mean, it's foolish to not call that out and say, if I operate in this postcode, I need as many referrals as possible to sustain, put food on the table, bread and water. But I think, making sure that if we've got those connected relationships, how we unite that voice and options that we have in 2020, which will be part of some stuff we'll be doing in February and March for budget time.
Yes.
And some policy questions or letters or submissions.
So I'd be interested in that, and maybe we can even mention that at the conference, what you're going to be doing.
Oh, look, and I think people are so hungry for it. I think it's, I mean, the bushfire is a perfect example. Not to highlight that's for all the people out there that are in a bad way, our thoughts and prayers are with you, and hope smoke clears. But I think it shows representative bodies aren't representing what the frontline professionals are saying.
No.
And if we don't supercharge that in a synergy, then it's always going to be, oh, they got that funding, I didn't get this funding, where's this funding, rah, rah, rah. And
No.
When we all hold each other in mutual respect, I think, and have a conduit to do it, which is part of my passion, is just organizing groups of people like you, get them together and say, look, non-negotiables, mental health policy. Because I mean, look, they've done that mental health national fifth plan and suicide and that type of thing. I would argue that stuff in there that's really valuable. How do we, as forensic psychiatrists to mental health peer workers, go, this is the one that we will not break on, and we need to come together to present. So it's going to be I wouldn't say it's going to be energized, just because it's something I'm very, it's we can treat the symptoms all we want, but the practitioners know. I mean, I know that if we're not charging back towards the problem as strong as we do the symptoms, then we're going to keep chasing our tails.
Absolutely. I'm also glad, just before you mentioned things like Reiki and other things like that, because I think not enough do we look to other alternative healing modalities, and there's all this focus on evidence-based practice that we can then find, the smallest little needle in a haystack to prove our very point, but then we miss the point of serving the client and serving the practitioners too. So we need to be serving the client, serving the practitioners, but also serving the general public, just in general, to be able to then help people. So, at the moment, because I live around Wollongong, and we've had, the smoke from the fires, but not the fires that close. But in Sydney, the fires have been really close, which is only 80 k's north of me. And honestly, the smoke that's come down, just talking about that, we were talking about it off air as well. So just the mere fact that we've got all of this smoke, it's like our physical health is now being impacted.
Oh yeah,
and
for sure.
Environment, and then of course the mental health is going to be impacted for everyone. And we all need a little bit of hope. And if I can help provide that through this conference, I mean, that's my feeling is we need to be providing hope to people, not stuck in a hopeless cycle.
Well, we did a radio broadcast, Transforming Perceptions, last Saturday, and we talked about that, and the disaster recovery is going to be absolutely huge. And I know when I searched on mental health disaster recovery training, I think New South Wales has one, but just even looking at that in itself, I think there's like I said, I think there's so many things spiraling around. I think if we can cement ourselves into where vulnerable people can recover and can keep getting support, sustainable support, which takes a strong policy, and strong commitment across professions is where we're going to get the right mix. Because governments change. I mean, we got an election in here in ACT in October next year. And I think if we're not really strong in numbers by a good time, it's going to be hard. And those people in recovery are going to struggle. I've got some Indigenous mates in Sydney that, you know, mobility issues, health issues, and then they, you know, they're alone really. And, you know, that was really hard for us, you know, it's, we'll come down. And it's like, well, there's so many other elements to it, not just pulling them out of that area and then go back in. So yeah, that'll be my Tuesday chat. I think we're going to have some action-based outcomes from it. I'm very much about what are we going to do now, and I think overall, politicians will be receptive if we have that buy-in, which is, I mean, that's kind of what Help Now Group does anyway. I mean, we've got counselors, social workers, peer workers, mental health nurses, gambling recovery specialists, and it's kind of like, well, we've got these players in the field. Let's just link them together because then we'll be unstoppable. Is really my I'll be seeing clearly. Pardon the 2020 pun. There'll be plenty of them.
That's the exact point. We're seeing clearly. We're also having a joint vision, and we've got this joint vision for, you know, basically the health and mental health of Australians.
Absolutely.
So on that note, probably would be good to wrap it up. But thank you for your time, Rodney. And yeah, sorry to the listeners listening in for the break. Technology sometimes doesn't work on us all. I don't know what happened there, but you know, there was a break. And so I hope you can listen to both of these excerpts because I think we've talked about some really interesting things in both parts. And thanks, Rodney, for joining us. And yeah, I hope everyone is safe out there and well, because there's a lot of stuff going on out there in Australia, particularly in the eastern states, particularly, you know, New South Wales and Canberra and ACT. So yeah, stay well.
Get your tickets. Get your tickets.
Yeah, we hope to see everyone there. Yeah, because it's,
don't wait.
But you know, all of the people coming who are presenting are really heart-centered people. And so this conference, just to let everyone know out there, is for counsellors, psychotherapists, coaches, doctors, lawyers, bankers, anyone who's in service-based businesses who want to actually take it to the next level of actually getting out there to do things differently for 2020 and beyond. So take care, everyone. Thank you, Rodney. Okay, bye.